Okay. So like I said, I'm Dr. Richard Kim, and this is our webinar for the month of May. Right here, a couple of housekeeping notes. Number one, if you're watching this at home, you want to turn your volume up. Number two, you've got a Q&A button below you. You can always click that to ask questions, and it looks like somebody has already asked a question, and I've responded, so I know that it's all in working order. But let's get started. This is essentially talking about how stem cells solve pain. We've got a couple of questions here. Number one, Joy from 315 said, success rates, how procedure is done, who can benefit from your process. And that's exactly what we want to go over here during this regenerative medicine review. And Thea from 514 said, what is stem cell? How does it work? And what is the ideal candidate for this type of treatment? Exactly. So we want to ask the what, the why, the who. Heidi from 518 says, overall, I'd like to know more about the process. What is regenerative medicine? How does regenerative medicine? So these are exactly the kind of questions we get all the time in the office, on these webinars, when we're out in public. And that's what we hope to help educate and address today. So we all have some common goals, and our common goals as physicians and as patients, and we even as patients, are all the same. We want to avoid surgery. Number two, we want to stop medications, as we understand some of these are dangerous, they come with side effects. And then number three, we all want to improve our quality of life. Um, when we do this, though, we want to ensure a few things. Number one, as patients, we want a plan. We want somebody who understands the idea of a plan. But we want that plan to be safe. We want low risk, short recovery, and avoid any pitfalls. Here's a couple of examples that we talk about commonly in our office. The first one is a retired psychologist who flies airplanes for a hobby, is a runner, competitive, but also does it for stress relief. The back pain essentially ended his running. That meant no more competition, no more fun, no more stress relief, and it really sort of impacted and limited his flying time. He talked about 45 minutes being able to go up and then having to land the plane because of back pain. Next is a chef who is a bit younger, enjoys spending time with his family, is in constant motion, obviously, by the type of work, and is constantly moving heavy restaurant equipment. The back pain was affecting his work, made his workday difficult, and contemplated changing careers. Traditional medicine misses the target. Traditional treatment limits are typically number one with surgery, they're permanent, it's invasive, often associated with a really long recovery. Something that sometimes we, as people who are either still working or interested in enjoying our retirement, don't always necessarily have the time for. Next is medications. Steroids, we know, are band-aids. They weaken and they damage tissue. But repeat steroids usually means repeat weakening and repeat damage. Over-the-counter medications lessen the symptoms. The effects wear off, and unfortunately, then you have to repeat the dose, and then you uh, are stuck in this cycle of medication wearing off, repeat dose. 2 months after stem cell therapy, the psychologist returned to running, ran the 4th of July race that we have here in town. It was a 4 mile race, ran at a 13-minute pace, but it gave him enough confidence to train for a half marathon with his grandson. And that was really one of the big motivators for him to go through this. The chef was back at work full time, able to provide for his family. So, pretty important features there. How exactly do we do this? Well, for us, it's about breaking the cycle. And the cycle is pain leads to degeneration, which then leads to further pain, and then degeneration, and then so on and so on. Sorry for the zooming in and out. The camera is new and I'm still learning here. The third solution, we are the third solution. So essentially with that, that means, we have something with a higher success rate, something that offers years of relief. And because we're utilizing materials that are extracted from your own body, that means something with guaranteed acceptance. Sorry, I went too fast there. So, what exactly is regenerative medicine? Regenerative medicine is a completely new field of medicine. And the goal of it is to restore but not replace tissues. unlike surgeries. We want to take that damaged tissue and turn it into healthy, functional tissues. Different materials are used to restore this, including platelet-rich plasma, or otherwise known as PRP, and then stem cells. The circles here are sort of how we decide, well, when do we do PRP and when do we do stem cells? Platelet-rich plasma, or PRP, is more for the green and yellow circles, and then the yellow and red circles are sort of if we said green and yellow was small medium, and then yellow red would be medium large. Red is bad, green is good. So if we said that the area of red in the top right corner of the video here shows where the inflammatory cells are, and that represents the pain, the stiffness, the sciatica. And the green is where the cells are moving towards that area, obviously to eliminate it, destroy it, consume it, make it go away. Pac-Man is one of my favorite analogies for this. If a pellet is a sign of inflammation, then one Pac-Man eating one pellet at a time is platelet-rich plasma. However, you put a bunch of Pac-Mans on the screen at one time, and that's what stem cells is like. The goal here isn't really to beat the level, but it's to leave the game behind, to leave the problem behind, and stop playing this game of inflammation and improvement and inflammation and improvement. With what we do, we're talking about something that can last 5 to 10 years. And that's a pretty important, I think, number to remember. Where do the stem cells come from? So the spinning pelvis on the left shows where we typically extract the cells. And then, for example, we'll inject it into a degenerative disc in the spinal cord here. This is a typical timeline for us. So we would have an initial consultation, followed by an MRI, followed by the first platelet-rich plasma. Then the stem cell and platelet-rich plasma at the second, and followed by a third platelet-rich plasma, obviously several weeks down. Physical therapy, then chiropractic or exercise is then instituted to help you build strength. As I typically tell people, we can certainly inject you for pain, can't inject you for strength. That has to be built. What can we train? Well, the neck and the back issues are pretty common here. We're talking about things like stenosis, the arthritis, degenerative disc, sciatica, pretty common diseases and words that you may have heard throughout your navigation of your medical issues. Lower body, arthritis, bursitis, meniscus issues, Achilles tendon. We just saw somebody with ankle arthritis yesterday, so very common issues. In the upper body, we're talking about rotator cuff, arthritis, tennis elbow, carpal tunnel. Again, very common issues that a lot of people, are dealing with. Now, the question is, am I a candidate? And the way we typically like to describe this is that if it can be injected or if it can be operated on, we have a stem cell therapy for you, meaning that if I can navigate a needle to it, we can treat it. The important thing here is diagnosis. Can you make an accurate diagnosis? If the physician, if myself can make the accurate diagnosis, then we're talking about the ability to accurately locate or have an accurate location of your issue, and then being able to apply an accurate therapy. And of course, our therapies all include an MRI to help ensure that we find that exact location. What if you've had surgery? The answer is yes. So even if you've had surgery, you can still undergo these therapies. The consultation is important here. This is, again, where we make the diagnosis and help along with the imaging, the history, the exam. Types of surgery is also important. Whether that was an arthroscopy, a fusion, or for example, a rotator cuff surgery. Some frequently asked questions: where will my stem cells come from? And the stem cells, in our case, is 100% from you. So we extract it from you and then put them back into you. How long before you can become active? Again, that timeline that we showed you, that third injection, and when we start physical therapy or chiropractic care is oftentimes when we would sort of release you to activity. Next question of when do I feel the benefits? Typically, and I'd probably say the majority of the time, 70% or greater of the patients feel the beginnings of the benefits at the by the third injection. We just saw a gentleman today who had his knee stem celled, and by the third injection was already at approximately um, 80% improved with, further to go. How long will the tissue stay repaired? Anywhere from 5 to 10 years, depending on what we're injecting. And I'll probably say what we found is that spines, both low back and neck, tend to last a bit longer. How well does this work? And that definitely is very much individualized. What you present with, not so much severity, but age is, sorry, not so much severity and age, but more an issue of fitness, and um, how fit are you going into the procedure? How fit do you plan to be afterwards? And obviously, those who look to be active tend to do better. So let's get to some Q&As here. Paul S. from 518 said, relating to herniated disc issues, as a follow-up to my very informative meeting with Dr. Kim, obtaining a deeper understanding of this science and procedure in addition to stats relating to success rates in various age groups. Example, a 20-year-old athlete versus a 70-year-old. So I will tell you that our results are excellent across the board and very similar across the board. We've had patients as young as 17 and as old as 94, all with very successful outcomes. Obviously, if you're a 20-year-old and you're trying to be athletic, it's a little bit different goal than somebody who may be 80, and your activity tolerance and your activity goals are a bit different. We've utilized these therapies to help Olympic athletes, and we've helped them to, for 90-year-olds to just walk around the block. And like I was saying before, older does not mean less success or less viable stem cells. Clearly evidenced by being able to treat 94-year-olds with relative ease of success. Again, what I was talking about before was success has more to do with a post procedure activity attitude. So if your goal is to be active afterwards, those are typically the patients that we see do best. Claude from 438 wrote in French. I'll do the English translation. How is foraminal stenosis cured? And so this is one of my um, common questions that we get, and I like to bring up the case of the jelly donut. So in the case of the jelly donut, we're talking about stenosis, where jelly is leaving the donut and then creating a crowding of the space around the nerve. So in our case, in when we're talking about foraminal stenosis, stenosis is definitely associated with both degenerative disc disease and arthritis. Therefore, if you treat the degenerative disc disease and the arthritis, the stenosis improves. Sean M. from 315 says, what types of back pain does it address? Does insurance cover it? If not, what is the cost? So spine and back, degenerative conditions, arthritis, stenosis, as mentioned before, etc. Sciatica tends to come along with a lot of this. And unfortunately, at this point in time, insurance does not cover it. So that is definitely one of our limitations with this field and brand of medicine. Asking questions about the cost, and you're going to hear me repeat this analogy several times. It's like calling a mechanic and saying, my car has a noise. What's it going to cost to fix it? Impossible to know without examining the car or leaving it with the shop. Same goes for us here. Jay from 315 said, continued pain from back injury 5 years ago, looking for a way to promote healing, relieve pain, numbness, and limitations. So for us, it's definitely about progressive degeneration that's related to poor blood supply. And it isn't a poor blood supply because of something you've done, but the injury typically disrupts that blood supply, or you're already injuring an area with a poor blood supply, and then therefore it doesn't heal very well. So your point is correct in that you want to promote this healing aspect, obviously to relieve the pain. And our methods are obviously non-surgical. The goal for us is to reduce the pain, improve mobility. Pretty simple. We have a very couple of simple targets, and we're pretty obvious, and we're pretty communicative about what that helps and what that doesn't help. When it comes to things like numbness, there are obviously it is out of that realm of pain and mobility, so definitely requires an in-depth conversation and exam with us in person. So we would highly recommend that when you get to us. Marianne from 315 says, I have severe stenosis at L2, L3, and a fusion for the same at L3, L4. My surgeon wants to do another fusion. I'm not so sure I want another surgery. I have only mild back ache and stiffness, but my main problem is I can't walk. I stagger, stumble, and drag my right foot. Can you help me? So a lot of what we're talking about here, it sounds like what we call adjacent segmental disease. And so adjacent segmental disease is basically when you've fused something, both the disc above and the disc below are like links in a chain. And so if you make it so that one link in the chain can't move, then the link above it and the link below it now have to do more activity in order to compensate for that link that doesn't move. What you're also talking about, staggering, stumbling, and dragging of the right foot, is neurologic and likely nerve related. We definitely would recommend a consultation and exam to understand some depth of that nerve damage. And that's going to be an important part of this conversation for you, Marianne. And I would say that that would be our first steps. Pasquale from 514 said you've got chronic back pain due to a fall. Doctors say you need surgery. Manage the pain with high doses of medicine. So a fall really disrupts that connection between the disc and the spine. And as we mentioned before, pretty poor blood supply. And so how the fall affects things is that if it disrupts that connection between the disc and the spine, then the nutrition or the repair mechanism is usually affected. Consultation is probably the next step, and then obviously get some imaging to help us understand what it is from the fall that's been damaged. And then obviously time probably has not been your friend, and so what else has time disrupted or made worse? Again, what we do is non-surgical, and our goal really is for you to get away from those high doses of medications. Charles from 315 said, I have arthritis in my feet, very difficult to stand, balance myself. So foot and ankle arthritis is very common. Again, we just saw somebody yesterday for it. And obviously, when you're having pain, it changes the sensation in your foot, and that can obviously lead to things like imbalance. Not to mention, you're probably getting weaker because you're doing less, and that doesn't help you either. The reduced pain, the goal of reducing pain and improving mobility, still the same for you, Charles. And remember, when it comes to feet and ankle issues, the surgical versus non-surgical methods are the big parts of the conversation here. We obviously are non-surgical, but when it comes to the surgical methods, they tend to be fusion or very permanent, and for a lot of people, uh, disabling and sort of limiting in terms of what they can do. So Natalia from 518 says, wish to attend in case Doc Kim reviews how ankles can benefit from stem cells. Thank you. So absolutely, Natalia, feet and ankle arthritis is definitely part of what we do. arthritis, plantar fascia issues, tendon disorder. So you said ankles, but wasn't sure if it was straightforward arthritis. So again, consult, exam, next steps, important. Gail from 518 says, what do you use for the stem cells? So again, going back to what we talked about before, pain and mobility, really the primary objective here is pain. Because so many people, because of pain, are obviously less mobile, and the goal is then to remove the pain and then therefore make you mobile. The conditions that we typically affect are things that are more degenerative, people who've developed some damage through time, through trauma, through overuse, you name it. So it could be athletes, and it could be, construction workers and general contractors, just people who sort of beat themselves up a bit. John from 518 says knee pain. So yeah, I'm assuming when you say knee pain, you might be talking about some degenerative condition and arthritis. What I like to bring up is my analogy of the building that's breaking down here. If you went into a broken down building, you would know that in certain walls, you'd see that there'd be holes in the wall. It's like going through and breaking down parts of the wall, punching holes in it. You end up with a bunch of debris on the floor. And when you end up with a bunch of debris on the floor, what the stem cells and the platelet-rich plasma are really good at is going in there and sort of cleaning that space. So if you can clear that space and clear the debris, you can walk across the room more easily. And just like your knee, if there's less debris in your knee, you can utilize that knee more easily. What you're not going to be doing through this methodology is filling in the holes of that wall where you're not going to end up growing new cartilage. And the question then becomes, well, do you really need to grow new cartilage? Most people say I have knee pain and not I have knee cartilage pain. So that becomes this big distinction here. So hopefully that helps with what you've been thinking about here, John. CKL from 802 says regeneration of a torn meniscus. So when it comes to knee meniscus tears, ligament tears, arthritis, cartilage damage, what we really feel like stem cell does is it helps stabilize a tear. And remember, 25% of people are out there with tears, but without pain. So essentially, if we can make you one of that 25%, you've got a tear, but you don't have pain, and this can last for years. How much do you how much do you care that you've got pain? And you remember, if you undergo a meniscus surgery, this can actually accelerate your arthritis. And this has been not just something we've seen, but we've known about for a long time through the research and literature. Martha M from 315 says questions about the procedure. And so hopefully I've done a decent job here of answering some of your questions. We do host a monthly webinar at about the same time, typically the third or fourth Wednesday of every month. And so you can certainly tune in into any of those or watch any prior ones. And we always record them and upload them. Again, you'll see me say the very same things for the first 20 slides or so, and then it gets more interesting during the Q&A. Rena from 518 said, would like to just view some webinars, hoping to find some help for a friend. Again, hopefully this helps. This helps your friend. Certainly invite you and your friend in for a consultation, and that consultation is free for the moment. At some point in time, we may end the free consultation phase, but for now it is. Nancy from 845 says, I don't have any questions now. I will probably have questions after I see the webinar, which typically happens. I was concerned that the stem cell is from human embryo, but I'm told that probably not. So I don't know. So we are very strict about how we adhere to the FDA requirements. And it's not an FDA approval process, but FDA requirements. And of course, we're pretty strict on that. We utilize something called autologous stem cells, or stem cells that come from you and then go back into you, versus allograft, which comes from another person and then back into you. Consultation always offered to you, Nancy, if you want to explore. Gabriella from 518 says SI joint pain. So this is a good one. This is something we get a question every once in a while, and it's worthy of mentioning. So sacroiliac joint is different. Sacroiliac joint is where you have the bottom of your spine and your pelvis meet. And because of where they meet, it can create a fair amount of pain. And there is this sort of tilting and balance that sometimes can get disrupted. So it is a fairly complex space. And unfortunately, X-rays and MRIs are very limited in that they don't do a adequate job of showing deterioration or arthritis in that space until it gets, quite severe. So a lot of people who actually have SI joint issues, Gabriella, will make a clinical decision, meaning from our conversation, from our exam, maybe even from one trial injection, and then we'll proceed forward with devising a more comprehensive plan for you. Consultation and history is obviously important for all of this as well. Anne Marie from 315 says stem cell for ankle arthritis, also for knee arthritis. Again, as we were mentioning before, arthritis is a very, very common reason why we do this. Not the only reason, but a fairly common reason. So when we often see arthritis, we're seeing it in the ankle, the knees, the hips, the shoulders, the spine, and these are all amenable to the kind of regenerative medicine that we do. Again, consult and exam. That one's blank. And SP from 518 says, I'm wondering if it's too late for bone-on-bone hip to be regenerated. And the answer is no. And I will say this grain of salt in all of this is that the words bone on bone we sort of feel are being overcalled. I think people utilize this terminology, and in fact, when people don't have true bone on bone, and I would probably say of the last 20 consults that we've done just this week, we see maybe one true bone on bone, and everybody else is nearing it or quite far from it and not ready for it yet. Um, but so I do think that it is being overused as a term. Um, and it's not just that, but it's not just bone on bone that sort of says, is it too late for hip regeneration? It's more about, the fitness level that you are in or the post-procedural activity attitude that is more the predictor for success, not so much the bone on bone aspect. Kelly HP from 607 said, can regenerative medicine relieve chronic pain near my tailbone, possibly related to a bladder sling that was surgically placed 8 years ago? This one's a little bit difficult and a little bit tricky. This one, I would say possibly. Really, we'll have to do an exam. We'll really need quite some specific imaging, and I'd probably say consultation, probably a little bit harder to sort of assess your issues simply over this webinar here today. Chris SP from area code 518 says, my last MRI shows a degenerative disc between L3 and L4. Pain that shoots down my hip and legs are so bad that I can't even sit straight. Sorry to hear that, Chris. Does Dr. Kim have a treatment where I don't have to come in the office? So our therapies, unfortunately, no. Our therapies are very much procedure based. We can certainly start with consult and imaging, but in the end, it will require procedure. If this is something you're interested, again, happy to offer a free consultation. Celia from 607 just said back pain. So this is one of the relationships that I wanted to talk about. In that circle, a red circle, something called the cartilage end plate. And then underneath that is the disc, and you can see how it sort of takes that jelly donut shape. So that jelly donut receives nutrition from that kind of giraffe spotted area, which is bone, through the cartilage end plate into the jelly donut. And when you degenerate or you destroy that cartilage end plate, you've ruined the relationship between that giraffe spot and the disc. And that's really what you need to preserve in order to help maintain a healthy disc, not regenerate, but maintain a healthy disc. So stem cells and platelet-rich plasma are things that do help improve that connection, and we do it through something called improving vascularity, and we're utilizing growth factors that exist within the platelet-rich plasma, exist within the stem cells that help create that connection, and at the same time reducing inflammation. So it's kind of a one-two punch. The analogy I like to utilize here is the cabin in the woods. If you build a cabin in the woods and then it starts to fall apart and you don't build a road to it, there's no way to rebuild the cabin. So stem cells and platelet-rich plasma is the road being rebuilt so that you can repair. And that's obviously the critical portion of repairing anything. You've got to access it. And that's really what stem cells and platelets help. Kelly L from 518 said hip pain instead of hip replacement, hip pain after hip replacement, arthritis in the lower back. So there's a significant overlap of hip and back pain. So I'm not surprised that you continue to have hip pain after or after hip surgery. Is that sometimes hip looks like back and sometimes back looks like hip. And being able to decide which is certainly part of what we do. Um, Regenerative medicine is our brand of medicine. Again, we're non-surgical. Everything we do is in office. You walk in, you walk out, always involving a shorter downtime. Roden S from 502 says help for pain. Hopefully, this was able to answer some of your question, Roden. If you have more specific questions, certainly encourage a consultation to come in and chat with us. Margaret from 315 said both shoulder and back pain. And so I would say yes, and yes, we can help with both. The shoulder versus the back pain, very different protocols, um, and both with excellent outcomes. We've done more than we can count and are very comfortable with both issues. Lewis Angel C from 956 says, do you guys also work on hip and foot pain? So the answer is yes. But what is the issue, right? So when it comes to hip, we're typically helping things like arthritis, degenerative joint, tendon issues in the foot, plantar fascia, arthritis, tendinopathies, and then many, many more beyond that. So saying hip and foot pain, question is, what's the pain? Like I talked about before, making an accurate diagnosis, and then finding the location so that we can apply the correct therapies. Doris from 315 says questions about diabetes and knee repair. Answered yes. Diabetes increases your surgical complication risk. So obviously with what we do, it's non-surgical, easier recovery, much better repair. Eva from 518 says, I have problem with my lower back and now trochanteric bursitis and piriformis syndrome in my right hip. So the gluteal muscles really support the spine, and the pain in the spine leads to then gluteal issues and then resulting in the bursitis. So when we treat the spine, we go after everything essentially all during the same treatment cycle. So not only do we treat the back and the spine, but we will treat the piriformis and then, of course, ultimately the bursitis. The way we really look at it is that bursitis is a result of a weak gluteal muscle. And so we do things, both procedures and physical therapy protocols that really address that so that the bursitis then goes away. Bruce from 518 says sciatic nerve damage impacting knee pain and ankle stiffness. So we're going to get to the next slide and help address Bruce's question here. Which also leads us to Erica's question from 518. It says, how stem cells can be regenerative and stop my lower back pain, back and sciatica pain. So you got to remember that sciatica is a sciatic nerve really is a wire, and the wire suffers damage. But it really depends where the wire is suffering from damage. So I drew two big circles here to show you that that sciatic nerve can either suffer damage from high up in the spine or lower down through the muscles or through scarred areas. And so that it matters. It matters where this issue is coming from. The damaged wire then leads to pain, neuropathy, and to burning type sensation. And the point of regenerative medicine in this case is to relieve damage to the wire. We want you to obtain this 7 to 10 years of relief, which we're typically doing or typically providing for people, and then getting them out of this sciatic nightmare. Francine from 518 says treatment options, urgent need for pain relief for a torn rotator cuff and 2 scoliosis curves. So scoliosis typically does not hurt until it does. Degeneration and arthritis of the spine is really what happens with prolonged scoliosis. For us, rotator cuff is usually a one and done. One treatment, it gives you typical resolution, and then no longer after that. So an important distinction between tendon versus not tendon. Donna from 585, just interested in finding out more information on how the stem cell procedure works. Hopefully what we've talked about here, talked about the process, talked about the procedure, reviewed how it works, and then talked a little bit about risk and benefits. And the important thing here on the risk and benefits is that the risk is very low. It's not surgery, it's not medication, no, very few harmful side effects. And of course, the potential for this large benefit. And of course, for a lot of people, understanding that and being able to weigh that and bringing that into your conversation about, do I take this ibuprofen or do I proceed with surgery? And weighing that should help you decide. Perry from 585 says risk of procedures, treatment, as well as success rates for people over 70. Again, talked about the risk benefit ratio. Age over 70, not an issue. Frequent part of our population to excellent. But I do want to know, what are we treating? So it is important to have that consultation to discuss. Even though you are 70 or 70 over 70, what are we treating? A knee versus a hip versus a spine issue? Are we treating a tendon issue versus a joint issue? So important distinction. Tiffany from 518 said, I'd like to know if stem cell therapy is right for me. Also, what stem cell therapy would cost. So it's a unique problem, right? And everybody with a new unique problem requires that unique plan. In-person consultation, highly recommended. Probably will require some examination of you, and then likely some imaging. Again, cost, the whole car sound and mechanic analogy, calling a mechanic and say, my car's making a sound, how much is that going to cost to fix? They have no way of knowing. Tam from 315 says process. Hopefully this webinar answered some of that for you. Every person is both the same and different. So, we are all humans in that we have muscles and tendons, but we all use our bodies differently or experience pain differently. So it's important to help differentiate what exactly is the same and what exactly is different. We've had experience for now 10 years plus, and then therefore sit very comfortably with what our success rates are like. Some important facts for you, Tam, is that we are again non-surgical, and with what we do, can provide years of relief. William S., area code 518, cost involved in the procedure. Again, this is a question we get a lot. So it's kind of like the car sound and the mechanic calling your plumber and saying you've got a leak. What's it kind of cost to fix? Or calling an electrician and say, I've got a bad wire. What's it going to cost to fix? Where's the wire? What's the wire for? How big is the wire? All of these sorts of things. So won't really know until the consultation. So I highly encourage anybody who's considering it or even has questions, even if it's cost, to come in and go through the consultation so that I can get an assessment of you. So we're doing a little bit something different starting this month. We're going to start a webinar attendee discount. So that's right. So if you head down the route of stem cells, we are offering a discount. You do have to mention that the word webinars and the fact that you did attend the webinar. And we do require that you at least schedule the stem cell within 30 days of the consultation. You can reach us at 518-871-9900 for the Northerners, 514-697-8919. Web pages, richardkimmedicine.com/webinars to watch any futures and any priors, and of course /MRI if what you're interested in is first obtaining an MRI. And we know some people would just feel comfortable that way. Our next webinar is slated for June 18th. So if you have a question, writing a question in the Q&A section is encouraged at this point. Let me see if we've got a question here. Uh, so Kelly asked, is the procedure painful? So that's a great question, and I will tell you that the procedure itself is typically not painful. There are some moments of discomfort, as you can imagine, with something like this, but overall not painful. Now, there is a post-procedural pain that you can expect, and that typically lasts. I'd say 3 to 4 days for a hip or a knee, and then typically 4 to 5 days for a spine or a neck. And some people are shorter than that, some people are longer than that, but I'd probably say about average. That's what you could probably expect. Any other questions? No other questions? Turned off the camera from moving. Okay. Oh, another one. Kelly again, is the post-procedure pain easily managed with Tylenol? Great question. So typically no. So we will prescribe for you a slew of medications, sort of everything from small, medium, large pain. Again, everybody handles pain differently, and so it's hard to know what you're going to respond to. And so for a lot of people, they may start with medium level pain medication. Some people start high, and we'll talk people and sort of give them a couple of different scenarios in what to follow. We have an idea of how much pain, say, for instance, a spine causes or versus a knee. So we do have specific protocols that we'd like you to follow. But everybody deviates from that based on their needs. Some people will up the medications, lower the medications, go for shorter, go for longer. But we do like to start sort of from a middle ground, and then we just dial up or down from there. So that's a good question. Kelly says, thank you for all the information. You are very welcome. Very, very welcome. Any other questions today? Okay, it looks like that's it from the standpoint of questions. If anybody wants to reach out, again, all the contact information is there. Otherwise, have a good night. Thank you.